Would you believe it's coming up to 20 years since I first registered. I became a pharmacist because I loved being part of my community. I worked in a local community pharmacy as a pharmacy assistant and dispense tech, and I had a fabulous mentor who just was so integral to his community and was there to support people and help people in times of need or when they're not feeling well and solve their problems, it was just inspirational. So that's why I love being a pharmacist, because I can be part of my community.
So I was a pharmacist for 20 years in a community pharmacy, and then in the last 10 years I've been working in regulation as well as the exam space. A pharmacist is a great opportunity to be able to help people. Medications are a large part of their life and it can make their life better and sometimes worse. It's our job to try to make it as best as it can be and provide their quality of life that they deserve.
Being a pharmacist is incredibly fulfilling because it allows me to make a positive impact on patients' lives, whether it's helping individuals manage their chronic condition in a community pharmacy, or educating future pharmacists at universities, or developing registration assessments with the Australian Pharmacy Council. I believe these efforts ultimately contribute to the growth of our profession and enhance our contribution to quality patient care. This gives me a great sense of purpose as I'm passionate about making a meaningful difference in patients' lives and look forward to more exciting times ahead for our profession.
I've had a reasonably long career and I've had many occurrences where I've felt fulfilled. The more fulfilling roles therapeutically was developing relationships with doctors who then obviously consistently came back and asked more and more questions, different topics, and those relationships gradually expanded and I was able to maintain them over a reasonable length of time. Later in my career it was helping more often than not fellow pharmacists through different situations. Some of those were simply a pathway to getting to where they wanted to go, which might be an overseas pharmacist being registered or a change in career path for an Australian-based pharmacist at some point, or even helping them understand how they might deal with certain situations. Overall, I'd say most days I felt as though I'd made a difference, but I wouldn't want to give you the impression it was every hour or every minute either.
We are involved in various aspects, from dispensing medicines to providing critical information about drug interactions, side effects and proper usage. In Australian communities, pharmacists also play a pivotal role in public health initiatives such as vaccinations and health promotion campaigns. We also contribute significantly to health literacy by educating patients and the community about their medications and health management. During stressful times such as bushfires, floods or the recent COVID-19 pandemic, pharmacists work diligently to ensure the continual delivery of professional services and the availability of essential medicines for their local communities.
Accreditation provides that quality assurance framework for the education and training that pharmacists need, not only just to practice professionally, but to evolve and to respond to different things as they come about. We saw this with the pandemic and the need for pharmacists to quickly adapt to the situation, to create these vaccination hubs, and we needed our interns and our students to assist with that. So having good quality education that is quality assured helps, I suppose, ensure that the services being provided, the training that people have received to provide those services is of a really good quality, such that patient safety is protected.
Happy World Pharmacist Day to all. Be positive in our space. Our space is very exciting at the moment with multi-D as well as collaborative work, and we've got a lot to offer, and it should be enjoyable for all.
I would say how proud at a personal level I've been to be a member of the profession, but even much more importantly how proud I have been of the profession over the last few years. I obviously have had a long career leading up to what was the pandemic, and what pharmacy was able to display during the pandemic was courage, We stayed on the front line when pretty much every other service was withdrawn, and gave a lot of support to the community. But our message and our flexibility became, it was demonstrated so widely during that time that I think the community's come a long way in understanding what we do. That's not to, and I know that sounds strange, but our ability to deliver a range of services has been expanded exponentially, and it's a really exciting time in pharmacy. But above all, I want to thank all pharmacists across the world in that time. Made a huge difference, and even in peace of mind, people could actually go and talk to someone during the pandemic. They could get advice. It wasn't always easy, and it certainly wasn't always easy for those playing roles in pharmacy, but we got through, and I think that does us an enormous amount, does us great credit. So I congratulate all the pharmacy. I'm so pleased I was part of that, and to be honest, it's very nice at your end of your career to have a big tick like that, so well done.
Our work doesn't stop at supporting education and accreditation. We're actively engaged in initiatives that promote cultural safety, innovation in pharmacy practice, and interprofessional collaboration. We believe that by fostering an environment of continuous learning and by upholding the highest standards of practice, we can empower pharmacists to meet the evolving health needs of communities around the world.
Happy World Pharmacist Day!